I teach on 3 days, 4 days no classes. I was thinking I may also get if your university needs extra teachers, I can teach there.
Oh, yes.
They need?
I don't know, but you should come
Yeah,
because I would really prefer having you
yeah,
come.
internal medicine. I teach best.
You can actually, because now they always have all these Chinese teachers who are all doctors working in the hospital.
Internal
So maybe
medicine.
if you approach them for it.
Yeah, it
Because
is.
we're doing internal medicine now.
Okay, okay.
It would be very good to have you
Yeah,
there.
it is all about. I know they need teachers always, but it is about how to approach them, who to approach.
There
That's the
are
problem.
few really cool podcasts
Yeah.
who are doing the Chinese
Okay. What's the name? No, I haven't heard. Contact. Okay. Okay. You also can talk with him
yeah, yeah.
about if they need extra teachers because I'm free. So most of the time in the afternoons, every day I'm free.
Everyone would really appreciate it.
Yeah. So we already covered adrenergic and cholinergic. I will review that. So I will cover that in the end. Okay. So let's first cover sedative, hypnotic, and anxiolytic drugs. So first drugs are benzodiazepines, barbiturate, and alcohol. So now these drugs. Okay, first you open your page. Okay, these drugs cause dose-dependent CNS depression. So at lowest dose, what they cause? Sedation and anxiolysis. At very low dose, they cause paradoxical disinhibition. Okay, this is why some people, who drink a little alcohol, they become more social because they cause paradoxical disinhibition. They disinhibit your mind. They open your mind. But as you go, they cause sedation, anxiolysis. You go little higher, they cause hypnosis, and then anesthesia. Means this is anesthetic dose. What if you go above anesthetic dose? If you give too much anesthetic, too much of any of these drugs, especially barbiturate and alcohol, what will they cause? Medullary depression. Now, what does medulla control? What does medulla control? Respiration and cardiovascular system. So, what will happen to patient? He will die. Okay, so you see too much alcohol, some patient die. Okay, too much barbiturate, some patient die. Okay, but what about benzodiazepine? It reaches a plateau. Okay, does benzodiazepine goes beyond this coma and death? No. So an overdose or toxicity of benzodiazepine, can it kill? No. So benzodiazepine, if someone takes too much benzodiazepine, he can sleep a lot, but he cannot die. But what about barbiturate and alcohol? They can kill because benzodiazepine reach a plateau and do not go beyond that. Okay, that is very important. So barbiturate overdose and alcohol overdose can kill. So you understand this dose dependent effect, okay, and especially important this benzodiazepine, okay, because this is a plateau, it cannot go beyond that, so it cannot kill. But other drugs, barbiturate, alcohol, they can cause medullary depression, coma, and death. Now, what is their mechanism of action? Their mechanism of action is that they open chloride channels on GABA complex. So GABA is the receptor for these drugs. But you see each one has its own binding site. For example, GABA binds at alpha unit. Benzodiazepine binds at gamma unit. Barbiturate binds at beta. But do you need to memorize this? No, just to understand that each one has its own receptor. No need to memorize. Okay? Yes, USMLE is not about memorization, it is about understanding. How do you activate any nerve? Do you depolarize or hyperpolarize? Means how you activate a muscle or nerve. You need to cause depolarization or hyperpolarization. Depolarization. So what will happen if you cause hyperpolarization? It will be activated or difficult to activate.